Good evening to all our participants, and thank you for joining tonight's AeHIN Hour webinar. Before we start, please be reminded that all phones are muted throughout the meeting. For comments, use the chat box, and for questions, please use the questions box. Joining us tonight to share his expertise is Dr. Sambath, who is a member of the AeHIN Working Council and is currently broadcasting from Cambodia. Dr. Sambath has worked as a team manager under the USAID-related project for over a decade and has contributed to the Royal Government of Cambodia in the area of social health protection, especially the health equity funds, health informatics, HIV/AIDS programs, infectious disease programs, and maternal and child health programs. He has a wealth of experience in healthcare strengthening, healthcare healthcare quality, and public financial management. He also worked with government partners in health policy development such as health protection policy, benefit package, and health HEF guidelines. May we now call on our speaker, Dr. Sambat, for his presentation?
Okay, thank you, Cha, for the introduction. So, my name is Ratana Sambat. I'm executive director for the Partnership for Better Health Organization in Cambodia. Some may know me, but some may not yet. So, I work mostly in health system engineering and also the health informatics in Cambodia. So, today I will present 2 points about the social health protection in Cambodia and also the PMOS, patient management and registration system in Cambodia. So this are linked together about the program and informatics for the social health protection. So in Cambodia, we have about 181,000 kilometers square, and we use the language is Khmer, and our currency area and population size about 15 million, and we have the labor for about 8 million, and unemployment rate is 0.5%. So we are not a big country, but about 15 million population. So work in Cambodia, we have two category in Cambodia that we call informal and formal. So for the informal employment, that some worker or people who are not recognized by the local authority, like motor taxi driver or home work, housework, etc. And for the formal, we have 3 components of the formal employment, that mostly from the government factory, yeah, and tourism and public administration, like from the government and NGO and private company, etc. So in Cambodia, we category work as a formal and informal. This refer for the health insurance concept. So for the healthcare system in Cambodia, we have about 100 hospitals and 1,300 health centers, and we have some NGO facility and a private facility. For the health financing in Cambodia, we have the result from the government, from the general revenue, and also from the donor support, that like from the USAID, World Bank, ADB, and other donor, JICA, UNICEF, etc. And also contribute from the out-of-pocket payment from the received service by the patient. And for the how to access the healthcare in public health facility in Cambodia, we have like two kind of payment. That one we call user fee, that people need to pay to get the service, and the exception, that exception no pay for the health service, like man or village chief, etc. And for the user fee, that tariff for the health facility like a health center or hospital, they have the tariff that patient will pay to get the service. So we have like a self-pay and third-party payment that paid by other people, like we have the program for healthy fund that paid by the government on behalf of the poor people, health insurance that paid by the public insurance like National Security Fund that under the Ministry of Labor and Vocational Training, and insurance from the private company or voucher program or community-based health insurance. So the kind of the healthcare system and how to assess the healthcare in Cambodia. And for the Haiti fund, there are type of social transfer mechanism that provide subsidy for the poor. Because in Cambodia, we have the poor about the 3 million that identified by the Ministry of Planning. We call ID poor. So this program starts in 1997, but the first is a pilot by the NGO, and mostly they pay by as a flat rate larger for the consultation, how much to pay, and for the inpatient, how much to pay for the flat rate that fixed by the donor or NGO support. And then later on, they will pay by the service, category service. And in 2018, we have add benefit package that we have about the 39 kind of the health service that will support by the Haiti fund. If the poor go to the health facility and get 39 the service in 39 of package that the government will pay on behalf of the poor. Chan, so far okay? Hello?
Yes, Dr. Sambath.
Yes. It's voice not clear. Just let me know. Yeah. And the package that we defined in 2008 is a Haiti fund program in Cambodia that we had the service in Riverol Hospital, former district hospital. This is a kind of the health center, but with the bed, and a health center that no patient bed. So the category for the Haiti fund, we government will support like IPD is inpatient and OPD outpatient. So they have some category like this, like medical service fee, transportation reimbursement, food support, and funeral support, social support. So for the hospital, the patient go to access service at the hospital, they will receive, if they are poor and have the ID poor card, they will got the support. No need to pay, and the government will pay on behalf of the poor that like for the medical service, transportation. For the outpatient, we don't support for the food because they not stay in the hospital. And for the former district, similar to the hospital that we have, but for the transportation reimbursement, not all just for the delivery or abortion care, and some support for the outpatient service. At the health center, that has similar for the support that medical fee and transportation, food support for delivery, and but no for the social support like funeral support. This kind of the medical and non-medical package that support by the Haiti fund in Cambodia. So for the social health protection, we have two kind of the program. That one we call social insurance that contributory, and social assistance that non-contributory. The social insurance that I will detail in next slide. So we will see. So the social insurance, we have the four categories that right now the program implement in Cambodia. That one is the pension, but not yet apply, and for the social health insurance already apply, and unemployment and disability. So this social insurance that cover in Cambodia, and for the social security or social insurance that we have a program like National Security, National Social Security Fund for the civil servant, but this just a coverage for the pension when they are retirement. We don't have, the government not yet start for the healthcare and injury for the civil servant yet. And for National Social Security Fund for the private sector that managed by the National Security Social Security Fund under the Ministry of Labor and Vocational Training, is the first is start with the injury, that insurance cover for the injury. All injury go to and sent to the hospital or health center. The fund will pay on behalf. But later on, they start with the healthcare that I just mentioned before, that we have like all medical care and transport, etc. And the pension just in the plan, but not yet start yet, maybe in 2019 this year. And we have the other program like community-based health insurance and healthy fund that already mentioned before, that for the all people who are the poor or near poor under the Ministry of Health. But this insurance like a voluntary insurance scheme. Yeah. So in Cambodia social protection framework, we have like this picture. You can see that we have two, like a social security or social insurance and a social assistance. So in social security or this social insurance, we have a pension and insurance for the health and employment injury, unemployment and disability. And for the social assistance, that from the government support, that like emergency response, human capital development, vocational training, welfare for vulnerable people. These are the umbrella of the social protection system in Cambodia. And the life cycle approach for the social protection system, we can see like this. So we have like from the pregnancy and childhood and to the poverty, work injury, disability, unemployment, health, and retirement, and program respond to the disaster. So this the life cycle of the approach for the social health protection that defined in Cambodia, but some still not yet held in the red. That's still a gap. And in the future, because in Cambodia we have a different fund, that national social fund. So in the future, the government plan to have only one, but not yet. So this institutional implication that we have the National Social Security Council that oversight all, and then we have the PCA, that Payment Certification Agency, already created but under the Ministry of Health. And then we have the National Social Health Protection Agency. We have government board, executive board, that we have program like social health insurance for the private employee, social health insurance for the civil servant, and social health insurance for the informal sector. But this structure not yet apply. And currently we have a separate program that responsible for the social security in Cambodia. The first we call NFV, that National Fund for the Veteran, that for the military who are retirement. So these are under the Ministry of Social. And we have the National Social Security Fund for the civil servant, and these are under the Ministry of the Labor. But this just right now just for the pension, don't have the insurance yet. And we have the National Social Security Fund that under the Ministry of Labor and Vocational Training, and this NSF play the key role for the mostly public health insurance in Cambodia, like for the formal and informal sector. And PCA, that Payment Certification Agency, this just create under support of our project that we call social health protection, and this created in 2018. That all the staff from my organization, we have about the 69 have transferred to this agency that paid by the government. So we have 4 separate institutions that are related to the health insurance in Cambodia, social health protection. And collective social security system, you can see in the diagram that the first they contribute from the state, and then contribute from the employer that pay every month from the salary, and because all like a private or NGO, or they will pay to the NSF on behalf of the employees for the contribution for the health insurance. So they can get from the worker and also from the government. So this the contributions to the social security system in Cambodia, and then we can have benefit for the healthcare, pension, injuries, incident. Yeah. And for the social security in Cambodia for the private sector employee, there are three pillars that first they cover about the injury, all injury that they can, the scheme will cover and pay for the injury. And after that, they have health insurance scheme that mentioned before, like a medical and non-medical packet, and a pension scheme for the retirement. But when the pension scheme for retirement not yet applied, they will start soon this year or next year. So we have also the social security for the civil servant that start in 2019 this year, that the government, that National Social Security Fund and SF contribute to distribute the membership card to the civil servant, and with all the 29 ministry in Cambodia. Yeah. Also, and as I has a registered public employee, former civil servant, and a veteran among the 317,000 civil servant, and also the former civil servant, and also veteran. That those people who have the card, they can access to healthcare, and like in the total they receive like 30,000 cash per time. These are some experience that the Cambodia have collaborated with Field Health in Philippines for the health insurance, but they are not well involved in this, or not clear about the program what they will do. For the population side in health insurance group in Cambodia, mostly we can see that civil servant just cover about 1%. But mostly for the private employee that cover more in health insurance, like 13%, and informal population that 60%, but not yet well covered by the health insurance. And poor people that through the health fund we have about 19%. So this through the Ministry of Planning that issue the ID poor card, yeah. And selected population that we call POW ID, that identify at the facility when they are poor and access the service at the hospital. So about the 7%. This is the size estimate that do by the JICA through the social health protection program, health insurance program. Yeah. This table to show the comparison, but I will not read all, because this we have like for the civil servant, worker, and employee social health protection for the informal population, and community insurance health fund. So we have like the aim, goal, and under enrollment coverage. Yes. So right now for the healthy fund, you can see here that about the 3 million that population poor are supported by the government through the PMI. So this PMI medical management and registration system is for the healthy fund mostly right now. So we have about the 3 million people in the database system, and we have other like coverage annual cost and other information, so that more about the health insurance program in Cambodia. So you can see the benefit package here, the last row of the table, that we have the benefit package, and the healthy fund that we have about the 39, that 36 medical service package that are supported by the healthy fund. Yeah. And other program, they still have different schemes, so that, and for the fund that under the healthy fund, you can see about the 6 million from the donor fund per year, and subsidized from the government about 4 million. 4 million. Yeah. It's like 60 and 40%. These are sample health insurance card in Cambodia that this yellow is for the healthy fund. This is a healthy fund card that issued by the Ministry of Planning, and this insurance card from the National Social Health NSS. Yeah. This for the veteran that under the Ministry of Social Affairs. So I think about the health insurance, health social protection in Cambodia. So I will go to about the PMI, that patient management and registration system. Why we do the PMI? That the first is to decrease the workload of the hospital staff, and also to improve the patient flow and the quality of care in the hospital, and provide data for the hospital management, and produce the monthly report in Cambodia. Monthly report from the hospital under the Ministry of Health, we call 802. Yeah, they have the form, and other report like surveillance and program report. And then the link the social health protection and the hospital data. Yeah. This about the AeHIN in Cambodia, that we have the system in Cambodia that from the population data that we have the CRVS web-based database system that start in 2013, and also we have the poor ID database that under the Ministry of Planning, that this they will collect the data every 2 years to update the status of the poor people. And then from the health facility, we have aggregate data that report through the HMIS, that through the web application that starts in 2010. And we had the patient level, that we had the PMI started in 2011, that mostly for the healthy fund. And then we have the health social program information system for the insurance hospice, hospital. Yeah. But these are for the health insurance. So we have a different system for the health program in Cambodia. And PMI patient management and registration system is the first electronic medical record in Cambodia, and started in 2010 in Siem Reap Hospital in Siem Reap province. So that time we just pilot in one hospital, and later on now full in Cambodia, that all the hospital apply and health center also apply. So the first implementation is aimed to improve the quality of care, that focus on the process and the care in registration, patient and medical clinical record, and also the financial. But later on in 2018, that PMI add the new purpose of the matching health financing and replace the FOC Pro database system. The FOC Pro database system is used for the healthy fund like from 2000. They start to use this FOC Pro, and 2016 we think that the FOC Pro is out of date. So we try to upgrade the PMI and then replace the FOC Pro, and right now we don't have the FOC Pro database system in healthcare. So it's a long time to use the FOC Pro since 2002 that for the healthy fund in Cambodia. And right now PMI also has the function that tracking clinical data linked to the larger mental health at the national hospital. So we have pilot for the mental health for the medical electronic record system. And in 2018, the PMI was adopted by the Ministry of Health and Ministry of the Finance for the under the control of the Payment Certification Agency, that PCA. We have to use all the hospitals in Cambodia, 100 hospitals, that including national hospital, provincial hospital, and district hospital, and about 200 or more health centers using PMI also for the financing management and reimbursement for the healthy fund. Yeah. So right now the PMI also under the the responsible of two departments in the Ministry of Health. One we call PCA, that Payment Certification Agency, that just created in 2018 under the Ministry of Health, and adopt and use PMI as for the control for the healthy fund program, also the claim reimbursement that they're launching in August 2018, and running cost for this implementation were paid by the government. So right now the PMI were paid by the government, including the hosting, staff, and maintenance, all training. So the government take over from our project that social health in URC. So. And PMI we have two kind of the implement sources. That one we have full PMI that with medical electronic recording system that under the DPI, Department of Planning and Health Information System, and one for the healthy fund program support that under the PCA, that is for the claim and tracking patient who are poor and receive service through the healthy fund program. So we have full category of the two category of the PMI. Full PMI mean that medical electronic record system, and healthy fund PMI that for the healthy fund program only. The current recording system in Cambodia, we have the healthy fund that managed through the PMI and under the control and leadership of the PCA, Payment Certification Agency, under the Ministry of Health. And we have the recording system for the health insurance under the National Social Security Fund, the NSSF, that for the private sector scheme through the Health Social Protection Information System, AeHIN. This system just new and piloted, but not well adopted for the whole country yet. This PIS is under the Ministry of Labor. And as I saw before, that we had the National Social Protection Council, that General Secretary under the Ministry of Economic and Finance. This the board, the board governor, the high level body that responsible for the health social protection in Cambodia. They plan to create the national health insurance information system, but not yet created. Just a plan for the national health insurance information system, and to support operation and management under for the universal health coverage and ensure achievement of universal health coverage goal in Cambodia. So this the midstream, but not yet apply, because it's still more parallel system like I saw before. We have right now four institutions who responsible for the social health protection in Cambodia. So they will plan to combine all in one, but we don't know when can happen. So for the PMI, the first we do the registration, that register all the patients, even the poor or non-poor pay, and then the clerk will register into the system. And after the registration, they will print the card with the lab band and they'll go to meet the doctor for the consultation. And after meet the doctor, they will go to the cashier for the payment, and then they will go to the pharmacy to get the drug and exchange to the home. This is the 4 steps that we define for the PMI at the beginning, that started in Siem Reap in 2010. So after we implement for the long year from 2010, 11, 12, 13, and right now we have add new function to PMI. There will more development on that. The first, for the new benefit package of the 39 service that will support by the healthy fund when the patient access to the healthcare in a hospital or health center, and plan to build the client registry that can share data between PMI to the health insurance program, and data sharing between PMI and ID pool. They already done, but not yet online synchronized, just backup data. Every month, the Ministry of every round Ministry of Planning, when they update the data for the ID pool, they will give the data to the Ministry of Health to upgrade the data into the PMI. So when the pool come to the hospital, they can retrieve the pool information from the PMI and confirm with the CAN. The patient file stored through the PMI. We use the digit to store the patient by the patient dossier by the code, by the code. The last 2-digit algorithm that we use to store the patient file. So all information we got from the national website for the PMI Cambodia.org, but they have in Khmer, not in English language. Thank you. That's my presentation. So time for the question and clarification. Chair.
And thank you, Dr. Sambath. We already have questions, so if you have questions, please type them in the box below. I think Dr. Alvin wants to ask a question.
Yes, thank you, Cha. Dr. Sambat, thank you very much for the very informative presentation. Thank you for dividing your presentation into 2 parts, a background on social health protection in Cambodia, and then how PMRS plays its role within this framework. I wanted to ask if there's if the HSPIS and the PMRS are still separate systems, but are they running in the same hospitals or are they running from different hospitals? Over.
Thank Dr. Alvin for your question. These 2 systems in the same hospital and still separate system. At the start, we try to have the interoperability to share the data, but not success because that we have a different leadership from Ministry of Health and Ministry of Labor. So the agreement cannot made. So right now, hospital have 2 systems, one for the PMI and one for the AeHIN for the insurance.
Thank you, Dr. Sambat. Actually, I think that's a common problem also, not just in Cambodia, but also in the other countries. If there is no agreement yet between the different ministries, then the data sharing cannot happen without that meeting of minds or agreements of the ministries. So I think it will be a process. It will be an activity that the Cambodians will go through the same way that other countries are also going through their own interoperability challenges. Would you know how many percent of the hospitals in Cambodia are running PMRS? Over.
100% from the public. That requirement.
100%.
Yeah, from the
100%
public.
public.
Yes, public.
Because the
hospital.
payment certification agency made it a requirement, right, for the health equity fund. Correct.
Compulsory, compulsory. In no implementation cannot get money.
Correct. So that's a very good governance mandate coming from the PCA. If you want to get paid, then you have to use PMRS as a way to file a claim or request for your reimbursement. How about
this a big change? When I start in 2010, all equipment training we pay for them, but right now no need to pay. The hospital need to buy the computer, buy the laptop, pay the per diem for staff to get the training. They pay themselves. The Ministry of Health just go there and train them.
Right. So in terms of supporting the PMRS, is there a group that is available for all the public hospitals if they need support from PMRS? Is it cloud-based or is it on-premise? Over.
Yes, it's a cloud-based. That my team, Hong Rut now he under the PCA. He paid by the PCA. So.
Yes, so it's easier to maintain.
Of the program,
Yes, it's easier to maintain because the system is being maintained on the cloud, and all
in the cloud for the Amazon. You use Amazon.
Yes, in Amazon. Is it?
Yeah, Amazon. Yeah, Amazon.
Yeah, that's good. So I remember I also requested and I also asked you about Open EMIS because there's the Open Insurance Management Information System that we are participating in as a community of practice. But I understand it's a different situation in every country. And in Cambodia, you're saying that the Health Equity Fund is already using the PMRS software for the management of the Health Equity Fund, right? But you also
Yeah,
mentioned that there are also other insurance systems, right? There's the
yeah,
NSSF for civil servants, and there's the NSSF for veterans. The
yeah,
NSSF for civil servants, they're using the HSPIS, correct?
yeah, yeah.
And then for the veterans, are they using the HSPIS or another
No,
system?
different system, different. Their own
And it's
system like
another
asset. Yeah.
and
They
it's
have their
another
own
software.
system. Yeah. Software also. Yeah,
Okay, so
software.
yeah,
Yeah,
so now there will be three systems: the HSPIS, the PMRS, and then the third one for the veterans.
yeah.
You had a slide on the exempted. What did you mean by exempted from? Is
In
it
the health
exempted from
faculty, we
paying?
have we have the health financing chapter that we have the user fee that paid by the people, and the exemption that not paid like a government man or like a man village chief and commune chief, no need to pay when they are in a health center or around health center coverage. Yeah,
Right.
yeah.
So
And
is it possible for PMRS to be the system also for civil servant and veterans, or it's very difficult politically?
political concern, no agreement.
Yes.
The
So
problem
maybe if there, Mhm. Go ahead.
now in the plan because the Ministry of Finance will take over all these three, right? We have three parallel agency institution for this fund. Ministry of Planning want to combine in one, but not yet happen. Even they have the much
Right.
power, but cannot do it. Yeah.
Right. So I think
So,
given the current situation in Cambodia, I don't think OpenIMIS as the software is the ideal solution because you already have software, right? Uh, but there's
yeah,
another group in OpenIMIS called architecture. So they're not talking about the software, but they're looking at what might be the ideal architecture
yeah,
for
like
an
a
open
COVID
insurance
fund
fund.
or
Yeah,
yeah, okay, yeah,
yeah, maybe for Cambodia, the architecture is easier compared to the software because you already have software running, right? You already have
yeah, yeah,
PMRS, you already have HSPIS, and then for the veterans, they have their own system. Maybe rather than talking about Open IMIS as the solution, maybe the three groups can just look at the Open IMIS architecture and maybe they can learn something about it, and then they can adapt some of those architecture and still continue using their own software. What do you think?
yeah. We will explore because we have the one program we call HP Plus, supported by USAID also. They do deal with the Ministry of Planning to have integrated system for the all the three, but they are
Yes.
advocacy.
Mhm.
But their program will finish in next few months. Maybe around September they will
Oh,
end the project, so
right,
no more soon.
right. So I understand there are three software and then there are three groups of people, but all of these software and all of these people they go to the same hospitals, right?
Yeah, same hospital.
Correct. So if I'm in the Siem Reap Hospital and I'm looking at a patient, I will first ask, are you Health Equity Fund? And if they say
Yeah,
yes, I will use PMRS for that patient. But if
yeah,
they are civil servant, I will use HSPIS for that patient. And then if they're
yeah,
veteran, I will use the veteran system.
yeah. In
correct?
some hospital, they
Yeah.
put labile, they put for labile where the patient to
Yeah,
go to pay or to meet first. Yeah.
right,
They
right.
put labile like you
Wow,
mentioned.
it's very difficult also for the hospital because they now have to
Yeah,
maintain and use three systems.
different
Can
system.
you
Yeah,
like
yeah.
you are a former civil servant and also a veteran, right, Dr. Sambat?
Cannot. No, cannot the
Uh, uh,
veteran. Civil servant
cannot do
only.
veteran.
Yeah, can only pension system. Pension. The
Okay,
veteran only military and police and police military also.
okay. So maybe Cha, do you have other questions from the audience, or maybe some people want to ask questions from Dr. Sambat? Go ahead, Cha.
We have Dr. Bunchai here. Dr. Alvin, I think he wants to ask a question because he was raising his
Go
hand.
ahead. Yes, yes.
Hello, Dr. Bunchai.
Hello, can you hear me?
Yeah, how are you, Doctor Vinchay?
Yeah,
Long
good. Thank
time
you
no
very
meet.
much, Dr. Sambat. And your presentation is very comprehensive, and thank you very much for sharing your information. Uh, I have a few questions. First is that uh, who responsible for the civil registration system? It seems like you have a challenging for the CRVS also. The second question is that the National Health Insurance Council, who will run those, or who will be oversee this kind of the overarching of this, the Prime Minister office, or what ministry? And I know like Alvin said that it kind of political. There's a lot of politicized among ministry over.
Yeah, Doctor Vinchay, thanks for your question. For the civil servant insurance is under the Ministry of the Labor that we had one institution that called that National Social Security Fund. So this cover for the health insurance for the formal and informal sector. Formal sector like the civil and private sector, NGO, and informal sector, informal like motor taxi driver and other that work without the contract. And for the National Security Council right now, through the plan is under the Ministry of Finance, and Ministry of Finance is a deputy prime minister also. So he had the power, but we don't know why he not move the agenda to complete to integrate into one yet, because maybe some political issue behind the scene.
Mhm. Okay, thank you. And I think any question from other audience, Cha?
Yes, we have questions from our participants. The question is from Dr. Pradeep. He's asking, can patients directly do the registration using authorized mobile apps from their smartphones?
Not yet. We don't have the self register system yet, even through the computer or through the phone, because the register I do at the hospital with the hospital clerk. So and we test this system with the mobile that in 10 health center and one hospital in one district with the tablet iPad, but not work well because we had a problem with the printer, because iPad cannot connect to the printer, and also the internet in a remote area cannot while for the access to the internet. So we stop for the smartphone or iPad use, and registration is done at the hospital by the hospital clerk.
Thank you, Dr. Ahmed. We have another question. Dr. Sujan has two questions. The first one is, Are the data from the two PMRs aggregating in any data warehouse? Second, what are the development technologies, including database?
Not here, but for the we don't have the data. We have the data is stored in the cloud, and it's a individual record that a patient individual record that patient data level and store in the cloud. And the program we are using the PHP language, PHP, and MySQL, store in the MySQL. That did any more?
Yeah, we have another question, Dr. Sambath. This is from Dr. Park. PMRS is for general EMR and HEF, right? So, do you have another software to manage CBHI?
For the CBHI, no, we don't have the national system. Maybe they have their own system. We don't know. Yeah, but we have the community-based health insurance. But they may have their own system, not the national, not the one for all. Yeah, because the CBHI supported by the NGO, so they have different their own system.
Dr. Park has a follow-up question, Dr. Sambath. If you have two PMRs for general EMR and GF, that means they work separately. Hospital staff needs to enter twice into two systems for a patient who are under HEF.
No, they if the patient access to the hospital, one registration system only, not talk about the health insurance. If they come to the access the health service in a hospital, like poor or non-poor, the question that Clovis asked, if they are poor, they show the card, and then they will register, and then the payment will under the healthy fund program payment. If they are non-poor, they will register and issue the card. They will go to the meet the doctor and then go to the cashier, and then they can pay. So before the PMI. But if they are not the poor and not pay, and they have the insurance, they need to go to the insurance system. Different database station, workstation that they go to the NHS, like a hospital HP system.
I think that's the last question from our participants. Any last words, Dr. Sambath or Dr. Alvin or Dr. Bajai?
First, thank you for all, and any country that have a similar program about the health insurance and healthy fund for the poor and non-poor, what they do is they can share later on. That may be great.
Thank you, Dr. Sambat, for
And one
delivering.
more, Dr. Alvin,
Go ahead.
for the client registry, we not yet success that, and the PCA also we plan to do it in future. But if this happen, we'll contact you AeHIN for some support for the client registry, because we work 1 year already for the client registry, that for the all linked to the CRVI, PMI insurance, but not yet success. So this.
Yes, Dr. Sambat. Once you think it is the right time, just let us know. We might be in receipt of some ASEAN funding, so we can go to either Phnom Penh or Siem Reap, and then support whatever the ministry needs over there. So with that, I'd like to thank Dr. Sambat and wish everyone good night. I'd like to request our chair, Dr. Punchai, to have the final word. Dr. Punchai.
Thank you, Dr. Alvin and Dr. Sombat. It's really nice to meet you in virtually again, and congratulations for your works in the last 2-3 years, and then you have made a lot of progress on your information system even if it's still a long way to go, similar to every country. I think that's a good achievement. And as Alvin said, that we might got some funding to do kind of the background survey to see the status of the health information system in CLMV country. So I think you would be one of our researcher to do this kind of for our ASEAN communities. Thank you very much again, and I think it's time and good night to all the participants and also Dr. Sombat, Dr. Alvin, and everyone. Good night.
Thank you. Good night. Good night. Bye bye.
Bye. Good night. Thank you.